when is it time to have knee replacement is a question that we're often asked. And so the big thing that folks have to remember about knee replacement is it's an elective surgery. I have many people that come to me saying that they've been told that they need a knee replacement. And it's really not like that. It's not, it's not like you have a heart blockage that needs to be unblocked immediately, otherwise you pass away. It's an elective surgery that you have to relieve pain because your knee is making you miserable. And so, as long as the conservative therapies for knee arthritis are working, so cortisone shots and physical therapy, as long as those are working, then there's no rush to getting the knee replacement. When patients start having pain that keeps them up at night, when they're not able to go up and down stairs, when they have to start using a cane, or particularly when they start falling due to their knee arthritis, then we say, hey, or maybe you should really consider, having the surgery because we can make you better and make the knee more stable, and it's probably time. When patients think about knee replacement, they think that it involves taking out the entire bones around the knee and then replacing them with some sort of large implant. And actually what a knee replacement is capping the ends of the bones. And so you take out slivers of bone on either side of the knee joint and then cap the ends of the bone. So as an example of the implants that we actually use during surgery, I have an actual knee replacement here. And as you can see, knee replacements are really just caps for the ends of the bone. And so you're not taking out the entire bones of the knee, you're just shaving off about 3/8 of an inch of bone on either side of the knee joint and replacing it with metal caps. This is the metal cap that is installed over the femur or thigh bone, and this is the metal cap that's installed on the tibia or shin bone. And in between the two metal caps, you have a high-strength plastic called polyethylene that acts as a bumper in between those two metal parts. And so it's a little bit like capping a tooth, but of course on a bigger scale. The surgery takes about an hour. Patients are able to walk on the knee the same day as the surgery, and they're up and able to get around. They have patients climbing stairs, in the hospital. That's part of the criteria for discharge is climbing stairs prior to leaving the hospital. And then most patients stay one night in the hospital and then go home. Some patients are able to go home the same day depending on how many other medical challenges that they have. The main risks of knee replacement are infection and stiffness after the surgery. And so the ways to prevent infection, the biggest one is to get diabetes, if you have diabetes, under control, and then get down in weight prior to the surgery. We do all sorts of things to prevent infection around the surgery. As far as stiffness, the big way to avoid stiffness is to really aggressively participate in the physical therapy after knee replacement. The pain control after knee replacement in the hospital is really very good. The physical therapy after a knee replacement is tough. If you talk to anybody who's had one, the physical therapy is tough because you just had this big knee surgery, and we have the physical therapist after you to move your knee and really get that knee moving as much as you can, because the more limber the knee is, in the 6 weeks after surgery, the more happy you're going to be with it long term. And so the physical therapy is something to really aggressively work towards during the surgery. If you poll people who have had a knee replacement, people would say it relieved 95% of my pain. And so there's still about 5% of the pain left when going up and down stairs on a cold, rainy day. But overall, it takes away all but about 5% of the pain that you're having before, on average. When you ask about the function, it has 80% of the function of an 18-year-old's knee. And so if you want a bionic knee that's just like you had when you were 17 or 18 years old, that's just not realistic. But it gives you 80%, which is a lot higher than most people are starting at. And so I think as long as you go into knee replacement with a good idea of what the surgery involves and a good idea of what your expectations are after surgery, you're going to be very happy with the outcome.